morning. Good to see you again.
Likewise, handsome. How you doing?
Very well. Better now.
Look at this. Look at this. Dun, dun, dun. Nervous Nelly here.
Oh, yeah?
Yeah, I think so. So I can't be more excited about this nose for obvious reasons. She's beautiful, gorgeous, amazing, but she's got a super wide nose. She's got irregular tip. She's got wide tip cartilages. She's got this hump. Her nose is really wide, all throughout both the bony here and the cartilaginous part. And it's a long nose. So the long nose, thinking when I say the length, it starts from here and it goes to the tip here. Okay, it's so long, that's why it heads down. You don't really see much of her columella. So I'm going to shorten her nose, which basically means something to that effect. But not that effect. You know, we're not going to give her a big nose. But the distance from here to here is going to be shortened, and this combination is just going to be absolutely phenomenal. So I'm super excited.
Me too.
How's your breathing? Good?
Very good.
Okay, breathing's good, and she's going to have super strong cartilages because you can see them right through the skin here. Just why you have the shape that she has. So this will be a fun nose.
Yay.
I'll show you how we do it.
Real quick, I want to bring your attention to something. We really appreciate you guys watching, but 96% of you, 96% are watching these videos regularly and you're not hitting the subscribe button. So please go do that now. When you do that, it helps us grow our community, it helps us get the word out, educate others, and in turn, just help others, okay? So hit the subscribe button and continue watching.
This is going to be one of them epic changes for the better.
Lots of moves on this one.
Oh yeah, big move. So therefore it's going to be just all upside. It's almost like seeing what happens on the nose will be big enough, but wait till you see what her face looks like.
How it changes.
Yeah, how it changes her whole appearance. Poor Josh Allen. Another.
Can't beat the Chiefs in the playoffs.
Nah. Nobody's gonna beat the Chiefs.
It was a close game then.
Yeah.
Think they're going to win another one?
Well, I think odds are. But Jalen Hurts is pretty good, and they got a good runner, and so it's going to boil down to who executes. And as the other team knows, you can't fumble a game away. Who was that? That was the first game. Am I a light on, or is it my imagination?
No, it's not. It's still not on Audrey. Oh wait, there we go. Never mind. Do you want it moved?
That's good.
Okay.
What's the magnification on those lenses?
These are, I think, 2.5. Pretty cool. So really wide cartilages as we imagine them to be. All right, let me get a stitch here. Pull on that. Okay. All right.
Oh, Audrey, his battery's going.
The battery?
On his.
How does it warn you?
It blinks.
A little blinking going on.
Who knows?
We're used to it.
Yeah.
All right, so let's show Micah a little bit of. So here are lower lateral cartilages. So they're big, they're wide, much wider than they need to be here, and they're a little bit asymmetrical. So we're gonna get to those after we get to the dorsum, and she's got a really. I think we're gonna have to use the chisel to get this hump. Her radix is right here. The radix part is like the root area here between the eyes, and that's pretty high, and this is solid bone. So if I use the rasp, I won't be able to get far. So I'm going to use the osteotome when we get to that point. All right. Knife. Get this out. Oh, she's dry, which is good.
I like that.
Which is good for viewing. That dilator really did a good job opening up her nostril here on this side. It was pretty blocked.
You had to get in there though.
But yeah, she had a big spur.
Did she?
She never complains. You know, a lot of people, it's like, it doesn't look like much on my end, but they'll say the breathing is fine. It's really when it gets to the critical point, you know, and it's hard to tell. That's why a lot of people go to see, you know, doctors with breathing problems, and these people get in there and I'm not sure that they actually help out in most cases. Man. There you go. Trying to get into the right plane. Once you're in the right plane, easy. All right. Head up. Table up a bit there, sir. So then we're gonna head towards the dorsum. Okay, that's good, and see what we can do to lower it. All right, so knife. You want to get in there, Micah? Can you see? I'll point out some stuff here. So these are the tip cartilages here. Let go. So right here. Okay. And then Mara will hold those. And then what we're left with here is this whole osteocartilaginous vault. Osteo, bone, back here, cartilaginous, all here. So this is the dorsum. And we're going to expose it and lower it. It's a sandwich, and I'm separating the layers of the sandwich. All right, hold that. And you want to get this, Micah? This would be good. So I'm going to start off by lowering the distal. I'm going to grab like 2 millimeters here. Head back. Yeah. Boom. And I can only go until I hit the bone, and then I stop. And this also it dulls
Dulls your blade.
dulls my blade.
I have a 15.
And that's why my hint to telling the nurse to get a new one. Okay, so there's a piece that we just took off. Okay, and that's going to lower this area right here, which is really nice, but then we got this honker area here. So we're going to use the big chisel. We're going to sharpen that chisel before we get in there. We're going with the chisel.
So just one touch of the bone just dulls that blade so fast.
Oh yeah, yeah. That's like a chainsaw hitting a rock or something. Oh yeah, your blade is done. You have a wider one than this? Yeah, that's not even near wide enough. It's a rhetorical question because I know we do actually. Oh, really?
Yeah.
All right, well, this doesn't look real wide, but we could use it. You know, sometimes when I use these like examples that are like manly, you girls should pipe in and kind of give a female example. Like, what'd be an example of dulling, you know?
Oh, you mean chainsaw?
Yeah. I'm using chainsaw, pickaxe or
the
something.
The last one we talked about car. Remember we were talking, it was all car references?
Yeah, well,
And
but what
then
about, I mean, can you dull like some makeup thing or something? I don't know. Makeup brush gets dull. Whoa.
It doesn't get dull, it just...
All right, you get the idea. All right, let's go here. So we're gonna easy, go. Hang on, I go. Okay, go. All right, go. Good. Go. Nice. Go. Nice. Go. Good. Go. Woo. Go. Hit the thing, not my hand. Go. Good. Okay. Oh boy.
This is a chunk.
Nice blow for freedom. Okay. Nice. Go. Good. All right. Get a scissor. And then So this sticks to the surrounding tissues pretty good, so I want to free it up before I
Take it out.
attempt to pull it out. Okay. Yeah, I didn't think so. This is not the best. We've been through this multiple times. The clamp is the best. Okay. It sticks to the surrounding area, so that's why.
Scissor?
Scissor. That's why I gotta free it up a little bit.
Sticking to skin tissue? Or?
It just sticks to the skin. And I don't want to necessarily rip anything. All right, let me try it again. Do you have a heavier clamp than this one?
This one. It's got teeth on it.
Lower the table again, sir.
Table down.
That's good right there.
Wilson, grab your keys.
It's called being obstinate. All right, scissor. All right.
Okay.
You have one that's not a.
No with no teeth?
Yeah.
Try this one.
Oh.
That's something.
Well,
Some
that's
part of it.
Some part of it. We want to get the whole part of it. Boom.
There we go.
All right. In business. Okay, so that's a good piece of bone that you can see is missing right in here, which I got to lower that significantly, which is a great thing. So this is actually lower than here, so I got to catch up a little bit. Part of that's cartilage, so we're going to work on that cartilage knife. Take that tip down. And she's got a
Well, not my leg. Everything gets kind of walled off right there. You can't start to move it.
Mm-hmm. There's a piece of bone right there, Mark.
I don't know if that's gonna.
Okay.
There we go.
And then we'll trim these upper lateral cartilages. Boom. Boom. All right, let's see what we got. Oh yeah, more betterer. So you can see that's lower, significantly lower. Now when you get a rasp in there, we're going to rasp the bone just to take it down even more. The edges here are pretty high. You hear that? I got a piece of bone that's floating around in there. Mm-hmm.
Clamp.
Yeah. See that? Yeah, that's the last of it. Get an idea what's going on now, huh? See the shape change? A little bit more cartilage right in the mid nose, right here. Mm-hmm.
Such big cartilages, it's hard to tell that you've taken it down.
Okay. All right. All right, so look how wide this is now. So this is super wide because we took the top of the house off the roof, and so as you take the roof off, the house just starts to be exposed for the walls internally and all that kind of stuff. And so it's called an open roof. And that's pretty good. Got actually a pretty significant lowering here in the radix, which is huge in her case, because that's a tough area to lower. And that's lowered nicely. You can feel the edge of her bones over here. You can probably see them. One's right here and one's way over here. This is the cartilage in the middle. But that's pretty even, so let's irrigate this.
Okay.
Suction, sir.
Dr. C, what's your favorite part about doing a rhino?
So, I would say it's figuring it out in terms of the balance. Like this, you can see I had to go through like these mental steps to, you know, reach nirvana. And once you reach nirvana, it's pretty cool. And so, finding that balance and, you know, getting the pieces to work together is really, it's like a jigsaw puzzle kind of thing. You got to get this puzzle to work together. And this is a big puzzle to work together here. So, this is going to come together, and wait till you see this. All right, so in the meantime, that's going to shift emphasis to the tip, in which case her tip is not that bad. The tip that I'm going to get here is I could see it. So this is a flare control stitch, which is going to control the divergence of this angle right in here. And we already said she has a wide tip and a boxy tip. So everything I'm going to do now is to sort of make it narrower. And in her case, it's more ladylike. So I'm tying this just to the tension that is necessary to achieve my goal, not just hammering it down. Okay. All right, now we're going to thin out these upper lateral cartilages. I mean, these lower lateral cartilages. I'm staring at the upper lateral cartilages telling you that, but see these right here are sticking out. Scissor. So this is remnants of the dorsum. Take that. Real distally here. So I'll get that down to... So every part has to come down so it's nice and even. That's pretty good. All right. We're going to do what we call a cephalic trim. So if you look here, I want about a 6 millimeter, 7 millimeter width. And let's take a look at what she's at. She's at, ooh, she is at 12 millimeters. So we're going to make them half the size.
You can tell they're very big.
Yeah, 12 millimeters. So we're going to bring those down. You don't want to go crazy on this because if you go too much, then you lose the support of your nose. If you lose the support of your nose, it's not a good thing. So I'll make these little marks where I'm going to all right, and local. So when you see me inject this local here, this is just to help the dissection because there's a thin layer of mucosa here, and I don't want to take that. So when you put this fluid underneath there, it separates the cartilage from this mucosa and gives me a little breathing room to remove it without taking it. There's one. So remember, we use this blade here that I have in my hand on the dorsum with all that bone, and what happens is if you don't change these blades out, you're not making it's like chewing. We want to cut clean. Boom. She's got long upper lateral cartilages. I'm actually going to do a maneuver. You don't see that often, but this is kind of cool. This is, I want her tip to rotate and shorten, but this upper lateral cartilage here is long. So I'm actually going to, and it's just, this is a give me here. You don't really see that often, that clean. Same thing over here. A little long.
You don't see that cartilage?
Well, not as nicely as you see it right now. Yeah. Yeah. Boom. Because we don't want that to, think of, I want this to rock back a little bit, and I don't want anything to be blocking. And this would be blocking it for sure. Finesse. Okay, let's see what we got. So, you can see that tip is already a lot better. See how much more narrow it is. Much better shape. And what's really keeping it this open is the bones here are way open. So the bones have an effect on everything on the nose, and so these want to be here, or I want them to be here. They're out here right now, so they're holding everything kind of spread out. And I know that because these stitches, these lower lateral cartilages are not shaped like that. But anyway, we're going to put a tip cartilage in here just to increase the narrowing ever so slightly. Good. Get me a more narrow tip. So that'll, yeah, in this case we're going to break the bones last. These are my domal sutures, which you've seen often. Most noses will get some stitch up here in the dome. As the tip goes the nose, which basically says the tip is pretty important. But I can make a strong case that it was all the work we did up here. In her case, that's going to be super cool. And then I can make an even stronger case that it's the marriage of these two that's going to make the biggest difference, and how well I do is going to determine how cool her nose is. And so the one thing I haven't really addressed totally, or analyzed even, is the length of her nose. And we're going to do that after I complete these steps. Nice. Good turn. Better tip. And if you could appreciate this, I'll show you outside the nose before I show you in, well, with the nose skin back, I should say. So I got these tip stitches in, which makes the tip here narrower, but also narrows this flaring here of the lower lateral cartilages. Now put the skin back, and boom. See how that's narrower? So even though the bones are way out over here, that effect had a really significant impact on narrowing the nose, which I'm kind of liking. Now you can also see that that I got some more tip projection with those stitches, which means the tip comes out here further, which is not a problem in her case because she's got a long face, which is kind of nice. So you can see this angle here already opened up. You see how this nose is already shorter? Can you appreciate that? Mm-hmm. Starts from here and it goes to here, and this angle is already being. Well, look on her, if you can see there. See that? How that angle is like a right angle, whereas this is already an open angle. So I'm not really even sure. Yeah, I mean, that looks pretty reasonable. I'm not really sure that I would shorten her nose even more. There's an illusion going on here, as always. This radix is a lot lower, so it looks like her nose starts here instead of up here. So that reduces the length of her nose right there. So do you get what I'm saying? It starts right here instead of, it formerly started up here, way down over here, which was big. That's why I used the chisel. So the nose starts here and it goes to this tip right here. That's a lot shorter, and this whole complex rotated. This looks nice. I like this angle. I'm not really sure.
That's pretty good.
I don't really have to shorten the septum. All right, that's pretty darn good. That's pretty darn good. All right, well, I think what we're going to do now is put some stitches in to secure the roof. You know, I'm a little, this tip, it may be a little too pointy. So I'm thinking.
You want scissor or knife?
Knife. I want,
It's a brand new one.
I want a natural separation a little bit in the cartilages here. So this narrows it. Let me see if this opens it up a little bit.
Oh.
Oh! See, I'm trying to separate these two a little bit here. All right, stitch. This stitch right here is designed to just control the shape of the tip a little bit. That's what it's doing. Nice. All right, let's see what we got. She's got really thin skin.
Yeah, that's what I was about to say.
Isn't it amazing?
See every little.
You could see everything, which is pretty. We knew that to begin with, so you could see her tip cartilages right here. It almost looks like it's a graft, but it's not. I mean, that's her skin. She's just got really thin skin. So she's not someone we're going to thin the skin. And that little bump that I'm seeing in the background here, right here, that's a stitch right there. See that? So I guess I could put that in and bury that stitch, but that'll absorb. But let's do that. You got to remove this one first. Knife.
It really emphasizes the thinness.
Of her skin. Yeah. Because they're tiny,
See a
tiny.
stitch under there?
Yeah,
Yeah.
that's what was giving that
It's a
little
tiny
Protrusion.
protrusion.
stitch.
So we're gonna
Princess and the Pea over here.
Uh-huh.
I'm gonna bury the
True
stitch.
Princess and the Pea.
See if that doesn't make a difference. That would be temporary anyway, and I know that. I'm just doing this more for you guys to illustrate some of the nuances. Because what will happen is that this stitch will absorb, so that little bump will go away. So, see now this stitch is what I call buried, which means it's down in there. All right. All right.
So are the stitches on the
Boom. You see the
inside
difference? That's normal. Much better.
Stitches on the inside are.
not dissolvable? They stay to...
Oh no, they're all dissolved. Okay.
Yeah, these are all dissolvable. All right, so let me just think about the evenness of the dorsum. Feels pretty good. That feels pretty good. All right, let's get some stitches across the dorsum. Let's use the other one. So we're just going to put some stitches in to sort of reconstitute the pieces that I purposely took apart, you know. So I'm grabbing this cartilage, mucosa, cartilage, mucosa, cartilage. Boom. It's like a sandwich. And I pulled it out to length. Which means I pulled it all this way. So I'm doing the same thing going back the other way. Boop. I'm going to have to put 2 of these in there because her nose is long, so she'll need 2. Some people just need 1. Rarely do they need none. So I can, as I move back here, I can see that it's still a little high here, so I'm going to put in another one, make it nice. Okay. All right, I think we're ready to really have some fun now. So best angle here would be coming down here or back here through Wilson's side here, because you're going to appreciate how important the narrowing of the bones is to the final result. I mean, it's, and maybe to answer to your question, all points of this nose are kind of super fun, but man, when you narrow these bones like this,
After you've done.
yeah, it's like, whoo-hoo, baby. Go. Okay. Okay. Go. 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 Nice. Mm-hmm. Mm-hmm. Good. Go. Go. Easy. Go. Go. Nice. Uh-huh. Oh, yeah. One more. Whew. All right. Uh-huh. 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 Boy. All right. All right, let's see what we got.
Andre, can I have some more of it?
So. Oh boy, jumping off the table here. Did you hear anything? Because I didn't.
I didn't.
I didn't.
So it was a
1, 2, 3,
clean
4,
fracture kind of
5,
thing.
6, 7.
And this fracture is what causes?
Yeah, because the bones were essentially straight up like that. Now I'm going to bend them towards each other. So it's like a closing the roof, leaning some big pieces of drywall together, or 2x4s, or
Yeah.
something. Check that out. You see how different that looks? You see, you can appreciate the contribution of the nose bone. And so these paired bones were open. Now when I feel this dorsum, it feels super nice. Goes into a nice tip with a nice tip break. Oh, I need a little bone. I feel a little high bone right here along the frontal area, so I'm gonna just knock it down. Little tap right there. Mm-hmm. 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 Whew. Okay. Go. Oop. Go. Okay, that should be it. All right, that's much better. All right.
You really see the difference there.
Oh yeah. So there you go. So you saw how we did it. Worked on the dorsum first, then worked on the tip, did some intricate things on the inside. We got rotation of the tip just because of the tip work we did on the cartilages and on those upper lateral cartilages right in here, which we're going to block this from moving this way. And there's also a huge perception of lowering the radix here, made her nose look a lot shorter as well. So the point of it is you just can't examine the picture and just say, okay, you know, let's do all these maneuvers. You have to sort of do them and then see what results. You know, and it's sort of an illusion to some degree. But that's how people can lose their way, and all of a sudden you're like, whoop, you know, did too much of this, did too much of that. Okay, suction, sir.
Because naturally her nose did start higher than...
Yeah, her radix is much higher, and so that's something we don't talk about often because she is sort of a really good case of that. You know, you don't want people all of a sudden like, oh, my radix is high or stuff like that. No, you know, it's pretty obvious when it's too high, but then you have to look how it looks with the rest of the face, you know, and that's why you have to sort of look at everything. Flush her out a little bit here. Okay, so basically I'm pretty good. I'm good to go. So we're good to go. So this is good. Base is good. Everything's good. So let's close. And the thing that really brings it home, the holy shit stuff, is the before and after side by side.
Oh my
goodness.
Beautiful.
Oh, it fits her. It's small like she is, you know? Wow. That's fun.
Lovely
I'm
ladies.
so excited because she's not that bruised. And lately we've had some rhinoplasties that were like pretty bruised. It's not the end of the world, but it just kind of like sucks when you're bruised. She's not, so I'm excited. I told you they were in a room.
Hello.
Got home and I was in bed like situated and was playing on my phone and I saw y'all's stories and I was like, that's me! And I literally sent it to like everybody that I knew. I was like, guys, look at this video, like look how cool this is.
Yeah.
Was it day of or like?
Yeah, it was like
I've
behind
been
the
like
scenes
playing because I'm like, is it weird when people wake up and they can like
No, I
see
love
stories?
So the girl before you, I guess
Yeah.
the week before. Yeah, because we did her on a Thursday and yours was on a Monday.
Oh yeah.
So, okay, so the girl we did on the Thursday before, so same deal. She posted it right away. And then that girl wrote me and she was like, oh my God. I'm like, did you see your story?
Yeah.
She goes, oh my God, I sent it to my whole family,
yeah,
like whole
that's cool.
thing.
Oh,
and
yeah.
then Amira was like, you think it's weird if I post like right away? And I was like, no, I think they like love it.
It was
Like,
so cool. I was like, Brady, my husband, I was like, Brady, I was like, look at all this. It was so funny. So
yeah,
I loved it.
it's cool.
Yeah.
I think it's a
Yeah,
good thing.
I like screen recorded it and everything, and whoever didn't have Instagram, I was like, look, watch me, and everybody was like, I don't want to see that. And I was like, no, it's cool.
Did you like cringe at all? At
No.
anything? Could you have done
No.
more
Yes.
content?
I wanted
more
to see
graphic.
more.
Okay,
Yeah.
It's
so it
coming.
could be more
Yeah, I
graphic.
know. I was like, I
Okay.
can't for the YouTube video.
Because I got some pretty graphic content,
No, it
but
was
I just didn't want to freak anyone out.
No.
I'm still playing with that.
No, I wanted to see that.
Okay.
So I loved it.
Okay, good.
Yeah.
Noted.
It was
So
awesome.
good, so good.
Yes.
All right, lay your head back right there for me.
So is this 1 week or a little?
One
Yes,
week, right? How good is the bruising for her?
Oh, bruising's like non-existent.
Nothing.
I did all the things that you guys said.
Yeah, okay, and hold on, let me open this up. So we were talking about how was the experience.
Yes.
So tell them what you told me.
Yes, it was not bad whatsoever. I was expecting kind of to be like in bed, like dead for about a week. But literally like after like day 1 or 2, I was like, I'm good to go. I was up playing with my kids,
Oh,
like
wow.
doing stuff around the house. By like day 3, the swelling was almost non-existent. I had a little bit of bruising, but I mean, it wasn't.
Yeah,
Even, like,
sit your head forward. I want that, like,
Oh.
lean forward, yeah. Look, just a little bit of yellow right
Mm-hmm.
here. Really not too bad. I can
Yeah.
tell by her tip, it's swollen, but not terribly swollen.
Yeah.
People ask that a lot, so I'm
Really?
glad you mentioned
Yeah.
it. Yeah, like, I don't want to freak out my kids.
No, they were
You know.
not even phased whatsoever.
That's great.
Yeah, it was amazing.
Well, cool. All right.
so
Well, we're
easy.
gonna get this splint off, and then I'll put some numbing on
Okay.
the tip of your nose where those sutures are, and then we'll let that sit for just a little bit, and then we'll take out those sutures.
Did you
Sounds
clip
good.
that strip at the tip?
No, did you do that at home?
I did that. Yeah, it had gotten wet, and so it was kind of like it had come off and was like flapping around.
Mm-hmm.
So I kind of trimmed it a little bit.
That's
I
okay.
hope that's okay.
That's okay. Your tip is swollen.
Oh no.
It's okay. It's okay. I just give you the disclaimer like, hey, this is swollen. All right, you can lean forward and look at it.
Oh my gosh! But even like the bridge, that's crazy.
I gotta look at it
That's
from
so
over here.
crazy to see myself like this. Oh my gosh, I'm obsessed.
Look straight
That's
on.
amazing.
Oh,
it's not even
wow.
that bad. Like not even that swollen.
Yeah.
But it will come down a lot.
Gosh.
Yeah. Like,
it.
okay, so this is good. Sorry, Amir.
Yeah,
This is good to see. Okay, like, look really close right here. So you can literally see where
The indention.
the indention is, where the splint stopped, and then there was nothing to cover it. So you see how
Oh
swollen
my god.
that is. Also, we always see swelling in through here.
Yeah.
And there was a like, substantial amount of like work there.
Oh yeah.
More than I've seen, like in the sense of like bone removal. So I
Yeah.
imagine that. Is,
Oh, don't tell me that.
Do you want to see it?
Kinda.
Okay. We have a picture.
That's amazing.
Yeah, it looks great.
Oh yeah, look at this.
I cannot believe that. I feel like a completely different person. That's all the bone that came out?
Yeah.
And cartilage, but it was a.
This is cartilage. This isn't the bone.
Do you
But-
have a
It
bone?
is, right?
No,
Ah.
no.
That's crazy. And
You'll
that was
see in the
probably
video. It's
Yeah.
probably the majority from like here.
because you
Yep.
like moved like where your nose started
Yeah,
down.
I moved it down.
Yeah.
I can
And
tell.
so you can see that
Look at that.
area is swollen, but
Yes.
that'll go down even
That
more.
is crazy.
Yes.
This is amazing. I don't
Wow.
want to stop looking at myself.
Keep looking. No, this is the time to do it.
I'm like, I feel so conceited, but this is amazing.
Yeah.
That's crazy.
Yeah,
I
It looks
cannot believe
great.
that. I feel just like a whole different person in like the best way possible.
Yeah.
Wow.
It looks
That's-
beautiful. And I can't wait for you to see it in 2 weeks, you
Oh
know?
my gosh, yeah.
You're going to be so shocked.
Wow, that's amazing.
Because how long until
I'm going
you
to put
guys
this little
say
numbing.
Okay.
final results, Lacey?
So, okay, I always feel like at 6 weeks, you're seeing a lot of your result, right?
Okay.
But I'm going to come inside here. I'm sorry. But, 6 months, I feel like you got to let it wait 6 months to a year.
Okay.
You'll see a big change. You can barely breathe out of this side.
That's my
Huh?
boogers.
It's probably dry blood.
Sorry. You're good. I didn't want to mess with it because I saw the stitches in there.
Yeah.
So I was like, I'll just breathe through one side. It's fine.
It's okay. It's okay. Okay. All right. We're going to let that sit and we're going to let Dr. C know you're in here and then we'll get all that
Sounds
out.
good. Can I keep this?
You can keep the mirror.
Mm-hmm. Just like hold up that
Yes.
photo next to her, and I'm just gonna take a quick video.
Do you like this one or do you like this one? What do you like?
I feel like I like the side.
Yeah,
Okay.
the side's amazing. That was my biggest insecurity, was the side. This is so-
I'm trying to decide which side I want to use.
I felt like this side was worse.
I was thinking that
Yeah.
too. Okay, I'm going to stand over there then. Okay. You want her to turn her head?
Yeah.
That okay?
Awesome. Awesome.
And then, okay, tell me when you got it.
Yep, I got it.
Got it? Okay, let's do the front too because I feel like,
I don't even want to look at that. Who is that?
isn't that crazy?
Woo!
Oh my
So
gosh.
awesome.
Oh wow. Yeah.
That is so cool.
I feel like even just the smile is so like, oh my gosh. Wow. This is
Yeah.
amazing. I don't even, I'm speechless literally. So good.
And one of the
It's
other
so good.
one of the other girls that we did her nose, she's 3 months out, and she's saying she still feels like it's getting smaller.
Yeah.
Like the swelling.
Really?
That's why I asked about.
Yeah.
How long?
Yeah, you'll find that you'll
Okay.
still notice that it shrinks down.
That's crazy.
Yeah.
It already looks great. So.
Right? I'm like, I'm happy with this. I can't even imagine when
Yeah.
like the swelling goes down.
Oh,
So
it's so
cool.
pretty. Congratulations.
Thank you.
It's so
my
fun.
gosh.
These-
Thanks for letting us film
Yes.
and post too. Yeah.
Absolutely. Post away, please.
Ah.
I'm excited for you.
Thank you.
She got to have more content to send her family.
Yeah, exactly.
Look at that, man.
I know.
Yeah. So I walked in the room and she wanted to give me a hug right away. That's how you know you did something right. And then she says, "Oh, what did you say? You moved my nose down." And then we were talking about the radix and how we looked at a patient who had a low radix. Remember the consult that was right after of a man that had a low radix, and I'm like, get to illustrate how the high, the low, and the difference. So it really just creates a much more beautiful balance. And she's super swollen in here, as you can see, because that's where a lot of the bone work is. Much narrower. I mean, perfect railroad track right here, which means nice, even bones here. And a swollen tip, but very nice. This is only gonna get better. So, and when you look at her and walk in the room, it's just
Yeah, that's why.
Some worlds different.
it's unbelievable. Because her nose was all about width. When you think
Who is
about
that? I don't even know who that is.
no, and so she looks.
That tip is so different.
So she looks
So
different, right?
different.
Her face. You see her face. You don't notice her nose.
Right. Yeah.
You know what I mean? I mean, you notice it now because we just swollen, blah, blah, blah. But I mean, look how it works with her face, which is really amazing. And you know, that it wasn't your side view. Except your radix started up
Yeah.
here. But, it looks a little longer. But
That
that
side was
view,
worse.
yeah. So that's kind of interesting.
And was that bone or cartilage right there?
This is her bone,
bone.
actually. So this was we used a chisel in her case, I'm pretty sure.
Oh,
We
yeah.
took out that big piece, and then that big open roof and all that stuff, and the bones came in beautifully, and did some nice stuff on her tip to work that tip in. But see how much? Look there.
Mm-hmm.
Already it's just way down, even though it's swollen, but because the skin is just kind of pluffed up.
And I remember her tip, her skin was so thin, you had to be real precise.
Yeah.
Oh, really?
Well, yeah.
You had to do a special stitch.
Yeah.
Ooh.
Look
at that.
You'll see.
Yeah, no,
You like
it's-
redid it.
It's awesome. So your nose is like the gift that keeps giving. So it's just going to get better with time. Girls will show you how to tape it up and everything,
Sounds good.
and then have fun.
Yes, they will.
You have to be like I mean, don't tell anybody.
I know. I'm like,
And just see who notices and who doesn't.
right?
You'd be shocked how many people will not notice. And so you're married, or?
I am, yes. And I have 3 kids.
Oh my god.
Yeah,
I know.
I have 3 under 3.
When you said you were
Watch
playing
that.
with your kids, I was like, how many?
Yes.
What?
Yes, I'm
They'd have to clock her pretty good to break those bones.
Yeah, they've learned. We said gentle with mommy. So like
Yeah,
they
yeah.
kind of they get it.
How's
but,
your breathing? Shallow, clogged up?
I can breathe through this side. This side's a little bit clogged up.
Okay.
Yeah.
So I'll take a look in there.
Okay. I noticed there were stitches inside on this side.
Yeah, you got
so
a bunch of stitches in
I didn't
there.
want to mess with it, so I kind of just let the boogers be.
Yeah, well, that's probably what it is. So that's once we, because your bones were so big, when we break it, it creates all sorts of swelling in there. That's only going to get better with time. But
For
I
sure.
did some rotor-rooter in there, so that should your
Awesome.
breathing should be just fine.
Hey.
Yeah. Should get in there. Got a bunch of stitches and stuff. Man.
Amazing.
That's just cool.
I'm mad that I waited this long to do it.
Yeah, well, it's easy for you to say. If it wasn't done right, you'd be like, oh shit,
Yeah.
what was I thinking?
Well, you know what's funny is I always knew I wanted to come see you. Like probably for like 5 to 7 years now.
Oh, wow.
I just didn't know. I didn't have a good timeline. I was having
Well, you
kids.
have 3 kids. Yeah.
Yeah.
I mean,
I was working,
Yeah.
so it never worked out.
Mm.
well, life gets in the way. That's what I say.
It does,
Well,
for
now
sure.
it works, and so it's really amazing. We need to get follow up. Like, you need to see this.
In like 6 months or?
Well, not even. Even like 3
Mm.
weeks from today would be like
Okay.
a huge difference.
Speechless.
Squeeze the nose.
You can't touch the nose.
Woo, baby.
What do you think?
I think it's
I
awesome.
love it.
What
so
did you look
much.
like?
Ugly.
Oh no! Oh
But
wow!
that one is
Oh,
one of my
wow.
favorite
Holy
angles
moly.
to look
No.
at it.
Different person.
Amazing. Different person.
You look like a different person.
I do.
What are people saying?
But she looks like herself.
Yes.
Well, no, I mean,
Yes.
yeah, we got to be careful when we say looks
Yeah.
like a different person. Holy moly!
Who
No,
is
I mean she
she?
looks like herself.
I mean,
wow.
it's like we talked about. It was such subtle changes that people look at me and they feel like they see something different, but they can't quite pick out what it is.
Your hair.
I shaved my eyebrows. No.
Oh my God! The beret you're wearing in your hair. Let me see the side. Wow, that is
Amazing.
gorgeous. Yeah, that is beautiful. Nice little slope there too, and she's still swollen, by the way. How far out are you?
4 months.
Yeah, it's
Yeah.
early, so
Fresh.
Yeah.
yeah. So what's like? Frontal view is huge.
Yes.
Yeah. So front. Look at that. Yeah, that's it. Get in there and smile, girl. Yeah, yeah. It's like, yeah. Get in there and smile. So her nose was wide, and so it's not so wide, and then obviously she had the Humpty stuff, long nose, better angle down over here. Very nice. Yeah, just a normal nose. I love it. It's amazing, actually. And we'll have these good pictures to show the difference. The tip was, yeah.
Yeah, the chip was bad.
Did you change your name? I heard you brought us in some treats.
Of course I did.
She's been so great on social media. She comments.
I appreciate
I love
that.
you guys.
I appreciate that a lot. So Micah, we work for cookies. Yeah, no, thanks for helping people because they're all like checking it out. Yeah, I need these. I need these cookies like I need a hole in the head. And we all say that, but we end up eating the heck out of them. You know, it's like. Who brought those cookies? And we're like, ew. And then like an hour later, they're all gone, and it's like, oh yeah.
I love that.
Congrats, girl. Thanks for helping out on social media too. That means a lot. You like that stuff? You look different now.
Thank you.
See, that's the problem.
It's confidence.
Yeah, baby.
It really is.
Confidence. It's like all of a sudden she's got this little badass attitude. You know, it's like, ooh.
I have a super outgoing personality, but it kind of like I have to be comfortable around you. And before I just like I didn't really want anybody to like look at me because I knew I could walk in and be like a personality and kind of be the loudest person.
And
in
now
the
you
room.
shine.
But now I want to because now I don't care if people look
No
at me.
one's staring at her nose.
Exactly. That's why I know they weren't. That's what I thought.
Well, that's the funny thing. So listen to what she said. She said they really weren't, but that's what they thought.
Yes.
And so now we just took away that impediment and created a monster.
You did. You did.
Yeah, she ain't eating those darn cookies. Well, we love you, and we appreciate it.
Dr. C, if this is it. Does she get to come back and see us?
I want to see her in a year because you're still swollen. Well, you come back next week if you bring the cookies.
Okay, just for y'all.
You're gonna wait a year? No, you can come back next week. Where are them damn
what
things?
What else do y'all like?
Yeah.
Okay.
A year would be good.
A year.
Continue to help us online.
Absolutely.
Well, help us. Help.
Yeah.
Well, help us
sure.
the educational stuff.
Helping others.
Yes,
Yeah, it's helping
absolutely.
others. Because you freely
love to
talk
share.
about stuff that people still can't talk about.
Exactly.
It's
and
really
it took
weird.
me 30 years to get there.
Yeah, no,
So
it's like it's almost like they say, it's like, well, it changed my person. It did, it freed it up. I know it's kind of weird. It's like, I hate talking about that much because it's like, wait a minute, it's just a nose, doc. Give me a break. No, if it holds you back and then all of a sudden you're like, boom, it's like, who's to argue with that? You know, we've unleashed a monster.
Y'all did. Yeah, I'm gonna tell my husband that. He'll love that.
Yeah, I heard he changed your name.
Yeah. I mean, we'll just be like sitting like next to each other or like, laying in bed and I can just see him like looking at me and I know he's like,
Are you serious?
Yes, and it's just so cool.
Yeah.
Like, it's just,
no, that is
been
cool.
awesome for sure.
I gotta be careful here now. It's like, oh my God, I hear stuff like that and it's just like, wow.
Yes.
It's a big deal.
It is.
We take for granted.
Yeah.
Yeah.
I was telling them earlier, I'm so mad that I waited this long to do it.
Well, but you're a master at sharing your story and it resonates and we appreciate that. Yeah.
Absolutely.
Yeah. Man.